Welcome to the Radiology Vault, an open repository for radiology educational content designed for learners and medical professionals. Presented by the Michigan Medicine Department of Radiology.
Hello everyone, my name is Hemant Parmar, and in this presentation we will review how to assess for brain myelination. I do not have any relevant financial disclosures for this presentation. Now, when we talk about brain myelination, we have to remember that this is a process of brain development which is happening after the birth. And this process takes place in the first couple of years actually. And this process is not random. There is a very clear direction, or what we call gradients, in which myelination proceeds. What are these? The first direction is central to peripheral. That means the part of the brain in the center, including brainstem and some of the central white matter, will myelinate first compared to peripheral white matter in the subcortical region. The second axis that we see is posterior to anterior. And the classic example is the occipital and parietal lobes will myelinate before the anterior frontal lobes. And the final axis that we see is inferior to superior, which is also similar to the first point, is that the posterior fossa structures, including brainstem, some of the white matter of the cerebellum will myelinate before the higher frontal and parietal regions. The other principle that we follow is based upon age. And what happens to that on T1 and T2 weighted images. So first is that the T1 weighted changes are seen before the T2 weighted changes. And that is because on T1, we see what is called as pre-myelin, whereas on T2 weighted image is actually what is the formed myelin. The other way of remembering that is T1 at 1 and T2 at 2. That means anywhere from 9 to 12 months, the myelination on T1 weighted sequence is complete. And on T2 weighted image, the myelination is almost complete anywhere from 18 to 2 months. So that is what we mean by the rule of age, that is T1 at 1 year, T2 at 2 year. Looking at a premature brain at 32 weeks, this is the T1 weighted image, and we can see that there is hardly any pre-contrast T1 hyperintensity to suggest myelination, and that is expected. But that changes when the child reaches full term, because at full term, which is anywhere after 36, 37 weeks, there are distinct 4 or 5 areas that we will start seeing myelination progress. And what are these areas? We will see that in the deep cerebellar white matter, the dorsal brainstem, the posterior limb of internal capsule, sometimes in the lateral thalamus, and then higher up in the corona radiata going into the motor strip or the perirolandic cortex. On T2 weighted image, the only reliable area where we see nice myelination forming is in the posterior limb of internal capsule, sometimes in the lateral thalamus and sometimes in the cerebellar white matter. But the PLIC is one classic area that you want to see at this age. This is the sagittal image of the same patient. The corpus callosum is well formed, but there is no T1 bright signal because there is no myelination. And then we will see how this thing changes when it is complete. At 3 months of age, the first landmark that we want to see, apart from the areas that we saw earlier, is the splenium of the corpus callosum. Why? Because by 3 months of age, the myelination has progressed and started in the parietal and occipital lobes. And as we know, the parietal and occipital lobes will cross over through the commissure or the splenium of the corpus callosum, which is an important commissure. So naturally, the splenium of the corpus callosum is also going to start showing some myelination. Compare that with genu, which doesn't have any bright signal. And of course, by this time, we see more robust myelination in the areas that we had seen earlier. On T2 weighted image, because T2 is one step behind T1, we start seeing good myelin now in the PLIC and the lateral thalamus, and some of it in the deep cerebellar white matter. The next stage that we want to see is at 6 months of age. And at 6 months of age, now we want to see myelination start in the anterior part of the brain. And then naturally, we will start seeing that in the genu of the corpus callosum as well. So now on 6 months of age, we can start seeing pre-contrast T1 hyperintensity in the white matter of frontal lobes. And by that extension, we start seeing some myelination starting up in the genu of corpus callosum. On T2 weighted image, again, because it's one step behind, we see very well formed splenium of the corpus callosum, but there is no myelin yet in the genu of the corpus callosum. At 9 to 12 months, realize that the T1 weighted images are almost complete and that we see very nice and robust myelination in the splenium, in the genu, and also in the peripheral white matter of both frontal and parietal lobes. So this is almost complete myelination as you would see in any older child or even adult for that matter. And then on the sagittal weighted image, we can see dramatic change in that corpus callosum where it's completely myelinated and we can appreciate all the different structures or the regions of the corpus callosum. So this is what we mean at T1 at 1 because anywhere from 9 to 12 months, the myelination on T1 is complete. On T2, we start seeing, or we should rather see the genu of the corpus callosum at this point, but not in the peripheral white matter. That will come at the next stage, which is anywhere from 18 to 24 months when the myelination is complete on T2 weighted sequence. And that's exactly what we see. This is a T2 weighted image at 18 months. And we can see now not only myelination in the genu and splenium, but also in the peripheral subcortical white matter of frontal lobes, parietal lobes, temporal lobes, etc. So this is complete myelination on T2-weighted images at anywhere from 18 to 2 months. So to refresh everything that we just saw at birth, we are going to see myelination usually in the central and posterior part, so including the posterior limb of internal capsule, lateral thalamus, brainstem, and sometime in the deep cerebellar white matter. At 3 months, you want to see myelination start in the parietal and occipital lobe, and then by that extension, you want to see it in the genu of the corpus callosum. At 6 months of age, you want to see the myelination now progress anteriorly in the frontal lobe white matter, and by that extension, the genu of the corpus callosum. Myelination is complete on T1 weighted image at anywhere from 9 to 12 months. And on T2 weighted image, myelination is going to be complete or anywhere from 18 to 24 months. So with that in mind now, let's look at a couple of examples. So this is a 4-year-old boy. 4 year is definitely older than what we would expect the myelination to be complete. He is presented with delayed motor development and some nystagmus. And these are the T1 and T2 weighted images in him. And we can see something which is very striking. And that striking is, of course, there is no myelin on T1 weighted image. Nothing in the central part, nothing in the periphery. And the same thing on T2. We don't even appreciate the nice PLIC that we should see right at birth, right? So this patient clearly does not have any myelination going on. And this is what we would name or term a broad spectrum of disease, which is hypomyelination. Hypomyelination has 4 or 5 disorders within it. But the biggest and the most important one that we usually talk about is something called Pelizaeus-Merzbacher disease. We do not need to know the name of this disease, but if you say hypomyelinating disorder, that is more than enough as a correct diagnosis for this patient. The second case is a neonate who presents with encephalopathy. So this is a very young 1-week-old child. And clearly on T2 weighted image, we realize something is very wrong because there is a lot of T2 hyperintensity in the cerebellum, in the brainstem, and also elsewhere in the cerebral hemispheres. And then as you see on the diffusion weighted images, there is striking pattern of restricted diffusion. That is in the deep cerebellar white matter, in the brainstem, coming up into the lateral thalamus, and then going up into the corona radiata, all the way to the motor strip. What are these areas? Of course, these are the areas that should have normal myelination at birth. And this is a disease which will involve all of those normal myelinating regions. And that disease is nothing but maple syrup urine disease, also called as MSUD. And this pattern of edema, which we see in MSUD, is called as MSUD edema. So this again helps us remember what are the areas with that are myelinating at birth. So to conclude, remember myelination follows certain directions, that is central to peripheral, posterior to anterior, and inferior to superior. And another good way to remember is T1 myelination is almost complete at 1 year. T2 myelination on T2 weighted image is almost complete at 2 years of age. Thank you so much for your attention.